Hey guys, Dr. Nora from Functional Physio and Performance Therapy here. Today, I'm going to be talking to you about two contributing factors to shoulder pain that you may never have thought about. So typically when someone has shoulder pain, we're going to think about treating the area just around the shoulder, okay? And we can definitely get good results from that. We can do range of motion, some stretching, rotator cuff strengthening, and all that stuff can be really good. But if we're not looking at the rib cage positioning as well as some of our visceral organs, specifically the liver, we could be missing a really big piece, and a big piece that may make the whole difference for you. So before we dive into that, I just want to talk a little bit more about the shoulder specifically and why we want to consider these other things. So our shoulder is made up of a couple different joints that we would consider to be the shoulder complex. So the first one, we're going to have our glenohumeral joint. So that's basically right here. We have a ball and socket joint. So we've got the socket that sits right here, and then our arm bone sits in there. And that's the ball. Then we also have our clavicle. So you guys probably know where the clavicle is. If you find it right here, you follow it out to your shoulder. We've got a little joint right there. So we need this movement at that AC joint or acromioclavicular joint to help our shoulder move well. And then we've got our shoulder blade, okay? So the shoulder blade sits right on top of our rib cage, and the top part of the shoulder blade is then what turns into that socket joint where we have the ball and socket. So all of these things work together to make the shoulder joint complex. And we're going to start with talking about the rib cage and why that is so important. And that's because our scapula, or that shoulder blade, it sits right on top of our rib cage. So our ribs are acting like a base for that shoulder blade to move on. Okay, so if we don't have a good base, that shoulder blade isn't going to move well. Maybe it's really stuck. It can't glide up like it should when we raise our arm over our head. And so that can be a problem. So if we're not looking at the rib cage and fixing that foundation, then we could do all the strengthening in the world around the shoulder, and it's not going to make a difference. All right. And then the other place that we are going to talk about is the liver. So our liver is this big organ. It sits right underneath our rib cage right here. And this can actually refer pain to the shoulder. And also if our liver is limited in its mobility or ability to just kind of move and glide with us as we move, that can lock down the rib cage and all of this connective tissue and fascia on that side. So we can see people who have this limited shoulder range of motion, and then we actually work on their liver, and then they can get their arm all the way overhead. So especially if you're someone who's really struggling with like that end range shoulder position, you're like, I just can't get there, I keep stretching and stretching, then this would definitely be something to consider of looking at your liver. So we're going to go into some more details about both of these things. I'm going to give you some exercises that you can work on, and then you can get started and try these at home. All right, so let's talk a little bit more about rib cage position and what we can do about it. So our rib cage, as we said, is going to be this base that our shoulder blade moves on. Now, a lot of people think they need to have perfect posture where they're standing up straight, right? Their shoulders are back, but this actually cannot be a very good thing. So if I roll my shirt up so you can see, if I'm standing here and I'm standing up super straight, I'm actually sticking my ribs out a little bit, okay? And this is what we would call flared ribs, where these lower ribs, you can see them sticking out. That is also putting my back in this extra curve here. Now, we obviously don't want to be hunchbacks, right, walking around like this, but we need our thoracic spine to be able to move in both directions. And if it's stiff and stuck this way, everything here gets really tight, and that's not going to be good for our shoulder blade to move on. So what I see most people stuck in is this flared rib cage position, and then their thoracic spine or their upper back is kind of stuck this way. So we need to reverse that, where we get the rib cage down and then allow their upper back to actually expand and round just a little bit. So I'm going to show you guys an exercise that you can do to work on pulling this rib cage down and getting some more movement through your upper back. But this is going to be a much better position for our shoulder if our rib cage is in this more just neutral position, right? Our shoulders are just relaxed. We're not trying to pull them back like this. And then as we go to lift our arm overhead, the shoulder blade is going to actually be able to glide and move, and it's not going to get stuck because we're kind of stuck like this. Okay, so this is our exercise to work on bringing our rib cage down and getting some more expansion through our upper back. I'm gonna put my hair up so it doesn't get in the way. So what you're gonna do, we're gonna be on our hands and knees. Shoulders are right over wrists, hips are right over knees. And then I'm gonna actually round my back as much as I can. Now it's important for the duration of this exercise that you keep your head neutral, so it should just be right here. I'm gonna look at the camera just to make sure you guys can hear me. But what we don't wanna do is drop your head down like that. So head's neutral. I'm gonna round my back as much as I can. And then I'm gonna inhale through my nose. And as I inhale, I'm gonna think about trying to direct that breath to between my shoulder blades. So if my inhale will look like this. And then on my exhale, I'm gonna stay rounded. I'm gonna exhale through my mouth. I'm gonna make this exhale really long as I can. Try to round even more, thinking about bringing my rib cage down. So we should start to feel these abdominals. So roll my shirt up so you can see a little bit better. So I'm rounding my back. I'm going to inhale through my nose, directing that breath between my shoulder blades, and then exhale. I'm pushing my hands into the ground, trying to bring my ribs down and using my abs to help me do so. Now my butt is relaxed, my pelvic floor is relaxed, I'm not squeezing anything here, okay? It's just abs and upper back. So we wanna do probably about 5 breaths or so. We're always trying to round more and more. So the more that we can round and open up that upper back, direct our air back there, get some good expansion through our lungs and our ribs, that's gonna help get rid of all of this tightness and then allow our rib cage to come down. So remember, we're doing this exercise so that way we're getting out of this posture with our ribs flared. As I round my back and exhale, right, I'm bringing that rib cage down. So give this one a try. All right, so let's dive a little bit deeper into the liver. So as I mentioned, the liver is this organ. Its job is to help detoxify our bodies, filter things out. You think about if we drink alcohol, that's gonna help get that alcohol out of our system. Okay, and so it sits on our right side. It's gonna be underneath our rib cage. So if your hands are on your rib cage, then they're gonna be over your liver. If you're down here and the squishy part, we're not on the liver anymore. So the liver's gonna be up here. It's this pretty big organ, and remember, organs are 3D, so it's gonna expand even to our back a little bit. And just like our muscles need to be able to like move and be flexible, so do our organs, okay, right? They're not moving all over our body, but they should be able to move with us. So if that liver just doesn't glide and move, it is just really stuck, then when I twist or bend forward or backward, right, that liver's not gonna move with me, and so it can then limit our motion. So that's definitely something that we want to consider. Like I said, if you are really limited in this overhead movement, especially on your right side, then the liver could certainly be something to consider, okay? So I'm gonna show you some easy ways that you can work on your liver and see if you can get some. So let's talk about how we can work on our liver ourselves. So I'm gonna use this silicone cup. If you put silicone cupping set in on Amazon, you'll probably find like 1,000 results, and you can get some that are pretty cheap. And then I've got a little bit of lotion. So what I'm gonna do is just put that lotion on. Remember, if we're on the liver, we wanna be right over that rib cage. Okay, and then I'm gonna just squeeze that cup. Whoop. Okay, I'm gonna squeeze the cup. I'm just moving it around. Right, I want to probably even work a little bit towards the backside. And if you find anywhere that's really feels tighter or like sticky, you're like, ooh, this is kind of uncomfortable, that's probably a spot where you need to work. So this is a super easy thing that you can do on your own. What I didn't mention was make sure you check your range of motion before and after you do it. So we can try putting our arm behind our back, trying to touch opposite shoulder blade. I can go behind this way. I can just come straight up, right? And then I'm gonna do that cupping, work in that area, and then recheck. So you probably only need to work for a couple minutes to see a difference. If you don't have a cup, the other thing that you can do is just massage in this area. trying to lift up your skin. So I would do this without lotion on your fingers just because you're gonna slide, but I'm just gonna go right over my rib cage. I'm gonna just pick up the skin and just kind of move it back and forth, okay? So again, if you find any area where you're like, oh, this is really hard for me to grab the skin and the muscle, that's probably an area where you need to work. Now, you're probably thinking, I'm working on the skin, I'm not grabbing my liver. Yes, you are correct. But by working on the area around it and the connective tissue in that area, we are going to make an effect on our liver. So those are just two super easy things that you can start with. Remember to test your motion before and after so you can see if it made a difference. If it does make a difference, keep doing it. If it made absolutely no difference at all, then the liver may not be an issue for you, and that's totally fine. That's great. Even if you still find some spots that you feel like are really sticky, it could be worth working on them. Now that we know the two other big contributing factors to shoulder pain are rib cage positioning and our liver, hopefully this empowers you to try these things at home, see if it makes a difference, especially if you've been struggling with shoulder pain. These are definitely areas to look at. And if you're still not getting where you want to be, definitely reach out. We see people with shoulder pain every day and are helping them get back to the activities they love, bench pressing, working out, lifting, picking up their kids, all without pain. So this is exactly what we do. And we really encourage you guys to seek help if this is something that you're continuing to struggle with.